Hello everyone, this is Dr. Aman from EduPedia Overseas from Germany. As you might know, I'm the Managing Director of EduPedia Overseas in Frankfurt, and I'm also a medical doctor. For those of you who don't know me, I also studied in Ukraine. To be specific, I studied at Kharkiv National Medical University. But today we're going to talk about a topic which actually no one talked about yet on the internet, and this is your health. Your health when you're going abroad to study MBBS, because most likely you're going to get sick. And I'm not talking about a flu or headache or stomach pain. These are usual things, but I'm talking about something which we have observed in the last years because we have a lot of experience in sending students abroad to study medicine. And this is like a frequent disease popping up in students during the autumn and winter time, because many of you are vegetarians, and once you're changing your atmosphere and the weather is going to be cold and the food is not going to be your mom's anymore, you're getting weaker and weaker. So many students of us get really weak during the autumn and during the winter time, and I would like to tell you beforehand what you can actually do. So especially if you are a vegetarian, before you leave India to study medicine in Ukraine, you should get a blood checkup. And this blood checkup should actually contain your hemoglobin level, your HB level, to see if you have sufficient blood inside your body to manage to travel, to study, and to be there on your own. If your HB isn't strong enough, you still have more than enough weeks to supplement it, just to take iron tablets and to get strong till the day you leave. Another thing is that many of our students are lacking vitamin B, B6 and B12 and folic acid. And those vitamins, they're so important to be strong in your studies, to memorize the things. And this is also like a problem why many of our students get sick, and then we have them to get lab analysis and everything, but until we start everything and they start the medication, they're missing classes and they're getting upset, and the parents are getting upset. So you can do this beforehand. Your HB level, your B6, your B12 level, your folic acid, and another very important thing is the vitamin D. The vitamin D is not only a vitamin, it is also a hormone as well. And this hormone and vitamin is important for your well-being, for your immunity, for your memory, and for your mood. So once it's getting cold and once it's getting gray in Ukraine, there won't be a lot of sunlight, but vitamin D is built with the UV radiation, with the sunlight. So this is when our students are getting sick, not only our students, but all the students. So what I would like to tell you is, please start supplementing vitamin D during the autumn and during the winter time, and get a liquid form from India. No tablets, because they are proven not to be so effective. And this is my recommendation. Of course, you should consult your family physician. This is my recommendation. This is what we have observed. So I'm guiding you as a doctor and as a former medical student. What else is really important, that if you have or if you had mental problems, and this is not a funny topic, but if you had any kind of history of depression, you should be very straightforward with us and also with your parents, so we know about it, so we can take extra care of you when you're abroad. Because being away from your family and having study stress could worsen your situation, and we need to make sure that you are stable. But sometimes this depression is also a cause from your study situation in India, from failing in NEET, and from all the burden you had to go through. And some of them actually might recover when they go to Ukraine to study medicine. But in any case, we need to know about it, and we need to talk openly about it. And that's why I'm addressing this issue, that there is no shame, but share this situation with us, so we can make sure that you don't lose any important time during your studies. So and one very last thing, we had also many students um, it turned out that they had TB. Yes, they had tuberculosis and they had to travel back to India to get a treatment. So our company advises the students to get a chest x-ray before leaving. The second you decide to go to Ukraine, please get a chest x-ray. Even though you don't have any symptoms, sometimes it's asymptomatic. I mean, TB is usually like this. You don't have real symptoms, and you can get a treatment now and then start studying later. We will help you in that. Also, the students where it turned out that they have tuberculosis, we send them back to India and we brought them back to Ukraine and we helped them so they didn't have to repeat the year. But just for you to save time and energy, get your hemoglobin checked, get your vitamin B6, your vitamin B12 checked, get your vitamin D level checked, and get a chest x-ray. If you're thinking, no, I'm sorry, I can't afford all these parameters because the lab is quite expensive, and I think B6 and B12 can be done only in America, so your blood has to be sent to America. You can take the supplementation, but do the chest x-ray. This is very important. All the other things, whatever will happen acutely to you in Ukraine, like appendicitis or cholecystitis or fracture or whatever it is, we're going to take care of it, of course, but these are the things we can actually prevent beforehand and everyone will be happy. So thank you very much for watching the video. If you have any questions or any other things you would like to share or ask, please do that in the comment box. Take care. Bye.
Like and comment if you find this video informative. Make sure to hit the subscribe button to get more updates from EduPedia Overseas.